Alicia. I'm a health coach at the UCSF Center for Excellence in Primary Care. Calling people for contact tracing or case investigation involves covering a lot of topics. In the process, the person being called can feel overwhelmed with questions and information. Let's watch a conversation that goes poorly.
I'm calling to let you know that you have been identified as a close contact to a person with confirmed coronavirus. I have some questions that I need to ask you.
Oh, okay.
How are you feeling?
Fine, I think.
Who is your medical provider?
I guess Dr. Flores over at the Kaiser on Geary. Hey, what am I supposed to do with my prescriptions?
Don't worry, I'll send you information about that. What kind of work do you do?
I'm semi-retired, but I have a home daycare.
Okay, so you can get a test with Dr. Flores and you need to close your daycare for 2 weeks.
I'm sorry, I have to get back to my lunch.
The contact tracer in the previous scenario did not provide an overview of the types of questions and information that she would cover during the call, or how long the call would take. She also did not ask the contact about her questions and priorities for the call. As a result, the contact experienced the call as a barrage of unrelated questions. She was also distracted by her unanswered concern about getting her prescription. She cut off the call, suggesting she may not be convinced of the value or purpose of the conversation. An alternative way to start the conversation is with setting the agenda, which refers to a short discussion at the beginning of the call to identify the contact's questions and concerns, share what you plan to talk about, and agree on a roadmap for the conversation. Setting the agenda is a collaborative negotiation to determine how you will use your limited time together. The following steps provide a quick and easy way to set the agenda with your contact. 1. Ask the contact what they hope to discuss. If the contact provides an item, probe to see if they have any additional discussion items. 2. State what you hope to cover during the call. 3. Review what you will talk about and in what order. This is a great moment to tie together what you hope to cover with what the contact hopes to cover. You can also be upfront about any items that you will need to get help in answering. In the next scene, we'll see how setting the agenda streamlines the conversation for both the contact and the contact tracer. As you watch, try to identify the steps that the contact tracer uses to set the agenda.
I'm calling to let you know that you have been identified as a close contact to a person with confirmed coronavirus. I have some questions that I need to ask you, and I wanted to address any questions or concerns that you may have. May I ask what is on your mind right now?
Oh, my head's spinning. I'm just thinking about whether my husband is to tell his workplace or stop working. And how am I going to get my medications?
Okay, so I'm hearing that we should talk about your options for getting prescription refills and how your husband should handle his workplace. Is there anything else pressing on your mind right now?
No, those are the big things.
Okay, that sounds good. And I'd like to talk about any symptoms you may be experiencing and share some information about coronavirus and quarantine. I would also like to assist you with testing or other support services that you may need. We will also have time to address any questions that come up for you during our conversation.
That would be good.
Okay, great. So how about if we plan to talk about your prescriptions and your husband's work first, and then I will ask some questions about your symptoms and quarantine, and we can discuss any other support you may need, including testing.
That will be fine.
Great.
In the previous dialogue, the contact tracer created an agenda for the call. She completed the steps through the following questions. 1. May I ask what is on your mind right now? 2. Is there anything else pressing on your mind right now? 3. Okay, and I'd like to talk about any symptoms you may be experiencing and share some information about coronavirus and quarantine. 4. Okay, great. So how about we talk about your prescription and your husband's work first? Because the agenda setting process acknowledged the contact's concerns, she felt more confident that her questions would be addressed. In turn, she was more open to answering the contact tracer's questions. Agenda setting fits best right at the beginning of the phone call, before you launch into asking about symptoms and any resources they may need.